Okay, here is the picture for ischemic heart disease. Ischemia is a lack of oxygenated blood, and it results in insufficient oxygen and nutrients for the myocardium. It's caused by reduced coronary blood flow and increased myocardial demand. There's four ischemic syndromes. You've got the angina pectoralis, myocardial infarction, chronic ischemic heart disease, and sudden cardiac death. And the chronic ischemic is many days of the calendar up above. Start with MI. You've got the atherosclerotic thrombosis resulting in coronary artery occlusion. Of course, most often it's the LAD. In the pathology of the heart, you got wavy fibers with edema in just 4 to 12 hours. And then you've got coagulative necrosis and neutrophilic infiltration in 12 to 36 hours. Then you got macrophage infiltration, phagocytosis of dead cells, formation of granulation tissue, that's in 5 to 7 days, and then scar formation in 10 days to 2 months. So clinically, you got a crushing substernal chest pain with radiation to jaw, left arm. You got an increase in ST. These are all things that increase in ST elevation on the EKG. Q wave on the EKG within hours. So Q wave. You've got cardiac troponin 1 is 4 hours. And then you got also an increase in CK and B. Treatment, thrombolytic therapy, coronary angioplasty for early MI. Inferior infarcts show up in leads 2, 3 in AVF. So try to remember that. That comes up often. F inferior. And you've also got left circumflex infarcts show up in V4, V6. Okay. You got angina pectoralis, pretty much chest pain, but there's different types. There's stable. Now, stable often only happens with some type of exertion, like somebody was helping somebody move, and all of a sudden they get this chest discomfort because they're helping. This is different. You got an ST depression. All right. Prinzmetal is a variant angina pectoralis. It's coronary artery vasospasms, episodic chest pain at rest, just sometimes, and you got this T, it's spasming, and you do have an ST elevation. Put that up. Unstable angina or angina, however you want to say it, is also called crescendo, or it's a disruption of the atherosclerotic plaque with possible thrombosis in the coronary artery. It's progressively frequent chest pain, also at rest. It's an indication for acute MI in the near future. And you've got an increased ST. So most of them are increased except stable angina, which is decreased. Treatment, nitrates, beta blockers, calcium channel blockers for stable. Prinzmetal is vasodilators, nitrates, calcium channel blockers, and unstable balloon angiography and revascularization. Alright, so chronic ischemic heart disease, as the calendar is going over here, seen in elderly patients with coronary atherosclerosis, and it's also where they have congestive heart failure that develops. Not going to go too much into that. Sudden cardiac death. There's a reason why there's a tombstone with a heart. Usually death within 1 hour of symptoms, and patients have atherosclerotic stenosis and acute disruption of plaque. All leads to fatal arrhythmias, and that's why it happens fast. I think that's actually what my dad died of. They never just said heart, but I'm sure it was sudden cardiac death. He hit the floor, he was gone. Keep those things in mind.